Thank you so much, ma'am, for kind words of introduction. At the outset, I would like to thank Dr. Mohan, Dr. Anjana, Dr. Ranjit, Dr. Pradeepa for having me here. Thank you so much, Sudha ma'am, for being here and chairing the session. Okay, so my job has been made very, very easy. Actually, my presentation is almost done by Cheryl and Meenakshi both. So there are little things that I'm going to emphasize on while speaking because the base has been set. Actually, the slide which Meenakshi showed on importance of protein in management of weight and diabetes study with Dr. Mohan, I think that should have been my first slide, but anyway, I'm borrowing it from Meenakshi, and I'm borrowing it from your memory to remember that slide about what actually protein can do and why do we consume animal foods. Primarily, in most of cultures, animal foods are prime foods. In our country, we use them as source of protein, but if you go to Western world, when they talk about a meal, they actually talk about protein. So when you ask them, what do you eat? In India, if you ask somebody, what did you eat? They will say, okay, I ate curd rice, or I ate chapati, or I ate paratha, whatever. But in other countries, when you talk about, especially Western countries, when you talk about what did you eat, it would be steak, it would be eggs, it would be ham, it would be fish. It would not be a slice of toast or a slice of bread. So therefore, and there is a lot of anthropological research which shows that as you move away from equator, people try to choose animal foods more than plant foods. The reason is obvious. Around the equator, the climate is better for plants to grow. And therefore, we can have variety of plant food. For example, in our own country, when we read literature from the West about source of protein, it really restricts itself to soy protein. Whereas in our country, when we talk about sources of protein, we have so many dals, right? Whereas moong, masoor, there are chana, rajma, there are so many dals. So more tropical your country is, more vegetarian sources of protein is available, and therefore we choose them. Whereas in the Western world, which is typically in temperate zone, you find that there are very less plant-based options. Although I am talking on animal foods, I am rooting for plant-based foods because that's really the way to go. Okay, so Cheryl spoke about this, and these are the healthy patterns which are associated with low risk of type 2 diabetes. Now, Cheryl showed a beautiful slide on blue zones, right? And me and Meenakshi were talking, and we said in our country, when people eat vegetarian also, they get type 2 diabetes and heart disease. And the answer was in Meenakshi's presentation, how you cook it, right? People in Okinawa are not making pakoras, right? If they are eating vegetables, they are eating vegetables, right? So they are not doing chai pakoda or any of those things, or they are not deep frying, or they are not giving tadkas, or oil is not floating 4 inches above the food, right? So therefore, that's the difference. It is just not what you eat, it is how you eat and how you choose to cook it, as important as what you eat, okay? So these are few slides which I'll be speaking on. So again, food from animal origin, if you look at the recommendations, they're very vague. So if you look at the ADA guidelines or any kind of guidelines, there are really no recommendations about how much animal protein to have. All that they say is emphasize on plant-based protein, but they really don't say, if you eat animal protein, this is the recommendation. It is a primary source of protein, and again, one has to understand, we categorize animal proteins as one group of foods, but they're very heterogeneous in nature, in the sense that egg is a completely different kind of protein if you compare it to red meat, if you compare it to chicken, if you compare it to fish. So although they are all grouped as one, they are very, very different in nature. Now, this is again a very interesting slide, that the dietary protein actually impacts insulin action and insulin secretion depending upon how you use it. So if it is unbalanced diet, then it will actually increase hyperglycemia. But if it is a well-balanced diet, okay, with caloric restriction, I think the name of the game here is caloric restriction. All your diets are going to work in the purview of caloric restriction. So if it is with caloric restriction, you find that there is control of type 2 diabetes. So when we say give more protein to a person with diabetes, it is in purview of caloric restriction. It is not in purview of ad libitum eating. Then it's not going to work. In fact, it is going to increase the risk of type 2 diabetes. So there are a few studies which have been which have spoken about animal protein and their link with type 2 diabetes. The one of the very important study is EPIC-Interact study. Again, it has shown that incidence of type 2 diabetes was higher in those with high of total protein and animal protein, but not of plant protein. Now the reason here could be, yes, animal protein has more saturated fat, or in general fat. If it's fish, even though it is not saturated, in general there is higher amount of fat. It does not naturally happen with plant protein. Plant protein naturally do not have as much fat as animal protein would be. This association, there are many women here, so this association was stronger in women, more specifically women with high body weight, women who were obese, and that's very, very important. Again, Nurses Health Study and Melbourne Collaborative Cohort also showed that high intake of total and animal protein were both associated with increased risk of type 2 diabetes, whereas higher plant protein intake tended to be associated with lower risk, just re-emphasizing what Cheryl said in her talk, that plant proteins are better for you. Again, difference between plant protein and animal protein on glucoregulatory markers and type 2 diabetes. There is data from pooled data from Nurses Health Study 2, and health professionals follow-up study. Again, this data was shown by Cheryl. Here again, it has been shown that replacing 5% of energy from animal protein with plant protein will reduce the risk of developing type 2 diabetes by 20 to 25%. That's a huge drop in the risk of developing type 2 diabetes. Replacement of 1 serving of plant protein with 1 serving of egg, fish, or red meat resulted in a 13% risk in type 2 diabetes, and replacement with processed meat resulted in 21% increased risk. When we mean processed meat is ham, sausages, anything that is processed in India, probably nuggets are something which are very popular even among younger age groups as far as non-vegetarian food is concerned. And dairy was the only animal protein food group which was at par with plant protein. That is what this data showed. Again, EPIC-Interact case cohort study, again it showed that 10 grams of higher daily intake of total protein was increased with associated with a 13% increased risk of type 2 diabetes, and a 10-gram higher daily intake of animal protein was associated with 12% increase in type 2 diabetes. And higher intake of red and processed meat were associated with about 8 and 12% of increased risk of type 2 diabetes. So what does this show? It shows that higher the animal intake, animal protein intake in terms of non-vegetarian food, especially processed food, right, will lead to increase in type 2 diabetes. So now, why is this happening? There are various factors. One of them could be heme iron, one of them could be increased amount of saturated fatty acids, which are associated with intake of animal protein. Now, there is another factor which has been shown, that is branch chain amino acid. So, high plasma levels of branch chain amino acid predict diabetes risk, and decreased levels are associated with improvement in insulin resistance. Now, remember one thing, all of the BCAA that are measured in the blood do not come from food. Some come from the gut microbiota, as Meenakshi was speaking about, that, you know, what you eat actually is processed by your gut microbiota, and they too release certain amino acids. So this is one of them. And other are also released when there is destruction of your muscle protein, right? So therefore, it's very important that you maintain your muscle health by exercising, eat good quality food, having lots of fibers so that you have better gut microbiota, and of course, eat a right kind of food. So high levels of, among the foods which increase BCAA, that is branch chain amino acid, one of them is animal protein. And typically it has been shown that people who consume animal protein tend to consume less of fiber. So when you eat non-veg, you do not eat veg, right? That's like non-vegetarians say it is like eating ghas-poos. So if there is chicken curry, you're not going to eat vegetable with it, right? So moment your fiber intake drops and your animal protein intake increases, you will find that your serum BCAA levels go up, and that increases the risk of type 2 diabetes. And therefore, if you're consuming animal food, remember fiber is more important than the animal food itself, and therefore do consume your bhaji or your salad or your raita with a lot of vegetables in it. That is really, really important. Okay, now these are animal versus plant proteins on cardiometabolic risk factor. Again, there are a lot of studies which showed that 30 gram protein daily from meat products, when they replaced with soya products in postmenopausal abdominally obese women, it led to improvement in various cardiovascular risk factor, including insulin sensitivity. Whether protein itself is doing this or the isoflavones which are associated with soy protein are improving cardiometabolic risk factors, we do not know that. That could not be explained. But in general, it has been seen that when animal protein is replaced by soya protein, there is improvement in cardiometabolic risk factors. Okay, so again, protein and amino acids are known to stimulate both insulin and glucagon secretion. When co-ingested with glucose, protein and amino acids actually can stimulate insulin secretion and can attenuate glucose response. And that is why graded eating is so important. You choose a protein before you choose a carb so that your carbohydrate management is better. So it has been shown that the metabolic effects differ per amino acid, with isoleucine and phenylalanine resulting in largest attenuation of glucose levels, while leucine had the largest impact on insulin secretion when co-ingested with glucose. And if this acute stimulatory effect of amino acids on insulin is conserved over the time as well, whether this is desirable effect to chronic hyperinsulinemia or actually it worsens insulin resistance needs to be actually established. So elevated fasting glucagon levels, that is hyperglucagonemia, is present in obese individuals with prediabetes and is a predictive function of diabetes development later on in your life. Effect of protein and amino acid on glucagon secretion and circulating glucagon can be one of the mechanism underlying the observation of increased diabetes risk associated with high animal protein intake, and that is why one needs to sort of keep the animal protein intake in control. Also, there is a systematic review and meta-analysis of about 20 studies that show that intake of red meat was not associated with type 2 diabetes risk, while processed meat was associated with 19% higher risk of type 2 diabetes. So that is what is important, that there are studies, but there is no conclusive sort of guideline which can tell us that, okay, do not consume red meat, or if you choose to consume red meat, this is the amount of red meat that you need to consume. But one thing is very sure, that processed red meat is something which is going to increase the risk of type 2 diabetes. Now, why is it so? Whether it is the sodium, it is the nitrites, it is the heme iron, or it's the protein content of the food itself which is causing it, we do not know. There isn't enough data to show that. Now again, fish. So there is different types of fish that people are eating, particularly lean fish, fatty fish, shellfish, and there is again no consistent data showing what is the impact of eating fish with type 2 diabetes risk. With dairy, again, fat-free fermented dairy products have consistently shown an inverse relationship between type 2 diabetes risk. Now, egg consumption. Egg is something which is very dear. A lot of vegetarians also consume egg, and therefore, again, there is a difference between the data of egg with Westerns, Europeans, and Asians. So while in the Western studies in US, egg per day was associated with higher risk of type 2 diabetes, but the same data was not seen in Europeans and in Asians. So we really do not know if the genetic differences actually make the difference in increasing the risk for type 2 diabetes. Now, again, we know that eggs are important source of choline, and egg consumption has demonstrated to increase plasma concentration of trimethylamine oxide, a metabolite of choline, and this plasma trimethylamine oxide is actually associated with alterations in glucose homeostasis as far as individuals from United States go. Poultry, that's your chicken. So most of the studies have shown that poultry consumption does not increase the risk of type 2 diabetes as dramatically as red meat or processed meat does. So among all the meats which are available, red meat, it is not protective, but it is not as harmful as red meat is. Okay, so higher intake, in Singapore Chinese health study, which was with about 63,000 participants, higher intake of poultry was associated only with a 15% risk of developing type 2 diabetes. In Shanghai Women's Health Study, greater unprocessed poultry intake was associated with a decreased risk of type 2 diabetes. So again, that is why you do not have strict guidelines to say how much it has to be consumed. Fish and seafood consumption. Oily fish may have protective effect against type 2 diabetes. Seafood other than fish may reduce risk of developing type 2 diabetes in Asian population, women, and in normal weight individuals. But what happens with Western population is again not known. Just because I have 3 minutes left, I think all of you should read this paper. This speaks about meat consumption and incidence of type 2 diabetes. It's a very, very good meta-analysis which has been done. And I'm going to just show what that meta-analysis says. Greater consumption of all 3 types of meat was associated with increased incidence of type 2 diabetes, that is red meat and processed red meat and poultry. So if you're going to have higher consumption of meat, it is going to increase the risk of diabetes. Among them, poultry had the least value. That's all this whole study is saying. The findings with poultry consumption were weaker so among them, weakest was poultry. So therefore, replacing processed meat and unprocessed red meat or poultry was associated with lower incidence of type 2 diabetes. So in conclusion, animal foods are superior source of protein as compared to vegetarian food. There is no doubt about it. It is true. Data shows that prevention and management of metabolic disease, plant protein are superior, especially in case of red meat and processed meat. So if there is a high consumption of red meat and processed meat, it should be replaced by plant-based food. Data on eggs, poultry, and fish is inconclusive. I think one part is genetics, because different data is showing different results with individuals from United States, from Europe, and from Asia. So probably genetics is one factor, but remember, other very important factor is method of cooking. And you cannot say enough about it. If you look at Asian cuisines, they are primarily steamed and boiled. And therefore, their visible fat intake is very less. Their inflammatory index of those food is less because they are not grilled and broiled like the food which are eaten in the Western world, and probably that might be one of the reasons. So cooking methods are very important. Another thing which is very important, which sets apart, and like Cheryl had shown the blue zones, in blue zone vegetable consumption was high. So if you look at Asian food, though they eat a lot of meat, for example, Korean population eats a lot of meat, but you see them eating kimchi with everything that they eat. So kimchi not only provides with probiotics as it is known, prebiotics, it provides with a lot of fiber. And that actually might be decreasing risk. I'm just speculating, it might be decreasing the risk. If you look at other food, like from Thailand, Vietnam, and etc., they eat a lot of meat, but it is always mixed with a lot of vegetables as compared to a typical Western diet, which is ham, bacon, sausage, and an egg with one slice of bread. So probably that's the reason. So what is eaten with animal food is actually important, and actually that determines the risk. Thank you so much for a patient hearing.